These are the 20 steps for positioning a patient for an AP open mouth. The patient is in a gown, in stocking feet. All artifacts are removed. Okay, I need you to come on over here and have a seat. Scoot your hips all the way in the back of the seat, feet up on the pegs, palms on your lap, looking straight ahead. We're going to place our anatomical marker in the lower corner of our 10 by 12 field. Next step, we're going to place our 10 by 12 cassette in the 10 by 12 position inside the bucky, lining up our arrows on the clip with the arrow matching the 10 by 12 designation in the bucky. Lock it in tight. Next step, we're going to measure the patient. The base of the caliper should be at the EOP, and the blade should be just below the bottom lip. Measuring in centimeters, she's 22 centimeters. So we're going to take that over to the AP open mouth chart. Okay, she's in a range of 22 to 23 centimeters. Setting the KV first at 66, MA at 150, skip the time, MAS at 37.5, and now we check our time and make sure it matches what it says on the chart. Chart calls for 0.250, and our time window says 0.250, so our exposures are correct. Next step, we're going to determine normal head carriage and mark that on the patient. I'm going to place a few points on your face. Is that okay?
That's okay.
Can you tuck your hair behind your ears for me? Okay. So I'm going to be marking her transverse processes on both sides. Okay, that's a TPUC one. I'm going to mark some points down your face. Can you close your eyes for me? I'm going to touch your chin. So glabella, philtrum, symphysis menti, and the center of the episternal notch. Okay, keeping your eyes closed, I need you to tip your chin to the ceiling. Come back down to what you feel is level with the horizon. Noting the canthus line. It looks like it is parallel to the floor. Keeping your eyes closed, drop your chin to your chest and come back up to what you feel is level with the horizon. Again, noting the canthus line. Give her a second to settle in. Again, she looks as if she is parallel to the floor or level to the floor. So you would express to your testing doctor the patient holds their hard palate or canthus line level or neutral to the floor. I'm going to step around to the front of you. And I'm going to place my hands on your shoulders. I want you to turn to the side that I tap. Okay? And return back to what you feel is pointing straight ahead. Noting where her chin dot lands in relation to her episternal notch dot. She's falling just slightly to her right. So I'm going to mark her landing point on her neck. Keeping your eyes closed, turn to this side. And once again, come back to what you feel is pointing straight ahead. Okay, give her a second to settle in. And she's in alignment with her episternal notch dot. So I'm just going to split that distance between her episternal notch dot and the first landing point with a high slash mark, and that is her normal head carriage position. So I want to make sure that her chin is in alignment with that highest slash mark during all of the images that we take. Okay, you can open up your eyes. Next, we're going to set bucky to patient. So we need to rough in our bucky height so that the 10 by 12 field is just up around her head and neck area, not too high or too low. We're also going to try to tilt this bucky to match the patient's anatomical head-shoulder angle. So we're going to look at the back of her head and the back of her shoulders, which is really the upper thoracics. And we're going to see what natural angle that forms. And we're going to try and tilt the bucky to match as closely to the patient's head-shoulder angle as possible. But before we do that, we want to make sure that our head clamp is locked in tight. As we tilt the bucky, we don't want it to fall forward, striking the patient. So I'm going to rough in a head-shoulder angle for her. And then I'm going to tell the patient I'm going to bring you back towards the bucky. And I want you to tell me what touches first, your head, your shoulders, or both.
Shoulders.
Okay, so her shoulders touched first. I'm going to bring her about an inch forward off the bucky. And since her head did not touch, I'm going to increase the tilt of the bucky with the top of the bucky moving towards her head, towards the part that didn't touch. And we're going to try this again. We're going to back you up one more time. And I want you to tell me what touches first, your head, shoulders, or both. The goal is to get the patient's head and shoulders to touch simultaneously without them changing their posture. We don't want them to lean back towards the bucky. Okay, one more time, tell me what touches first, head, shoulders, or both.
Both.
Okay. So we're going to lock her in. All right. Bucky to patient, patient to bucky. Next step is tube. For the ADP open mouth, we want to set our focal film distance so that the arrow on the tube matches the arrow on the track that says 40 FFT. We also need to make sure that we set our tube angle. And for an APOM, the white needle on the gauge should be at 50. So we're going to increase our tube angle. So the white needle hangs on 50. Oh, I'm sorry. For the ADP open mouth, our tube angle should be 18. So the white needle needs to hang on 18. So we're going to go ahead and set that. I'm going to raise my tube until the horizontal crosshair goes right through the corner of her mouth. And that's a good starting point. Okay. Holding still, I'm going to raise this bucky up just a little bit. So I need to sight the horizontal beam through the corner of the patient's mouth. That's the anterior strike range. When we have her open up her mouth, we're going to sight along this beam to make sure that our horizontal crosshair is not striking the top or bottom molars. Okay, so I'm going to turn this light on. I want you to close your eyes for me as I sight this. Go ahead and open up your mouth for me, wide. Okay, great. So my horizontal beam is positioned correctly. It's passing through the corner of her mouth, not striking top or bottom molars. So we're good with our anterior anatomical points. You can close your mouth. The posterior range, the horizontal beam needs to be between the bottom of the tragus notch and the top of the TP. So I can see that beam when I turn this light on. Okay, so our anterior and posterior anatomical points are being struck by the horizontal beam, so we're good. We also need to make sure that we raise or lower our bucky, if necessary, to make sure that this little slash mark that says APOM lateral superimposes the horizontal crosshair, and it does. So we're good there. So bucky to patient, patient to bucky, tube to bucky and patient. Next thing we need to do is check for any head rotation and tilt. And she is rotated a little bit towards the wall. I can tell because that is the orbit side that is narrowed. So I'm going to turn her towards the left, towards the wide orbit side, and that takes out her head rotation. Let's check it again. Her orbits should be even now on both sides. That's correct. I'm also going to check for tilts. If I see any head tilt and she has a little bit, I'm going to stabilize her at the jaws and at the shoulders. I'm going to touch you. Please lean in the direction that I tilt you. So we're going to go in this direction. Hold that posture. With her holding that position, I'm going to unlock the chair and I'm going to slide her back. So she's right down that vertical crosshair. Okay, once again checking for head rotation and tilt. Make sure nothing drifted back in. Make sure she's right down that vertical crosshair. And then, next step, after we've corrected for head rotation and tilt, is to head clamp the patient. So these are soft padded head clamps. They're going to come in right about your earlobes. They're just going to touch. They won't squeeze. Just to give you a little guide so you don't move during the picture. Okay. All right. If the head clamp pushes the patient at all, just open them up a tiny bit and align that patient right back down that vertical crosshair. And we can bring our pads in again. Okay. Tell me when you feel them touch.
Touching.
Okay? All right. Patient's head clamped. Next step is collimation and filtration. So we're going to bring our top and bottom collimation shutters. These are the horizontals. I'm going to bring it up until I can see it coming into the anatomical marker on the bucky, and then I'm just going to slowly back it down until it's just barely grazing the bottom of the R marker. Now that I've brought the collimation in on the horizontals, I'm going to come in on my side shutters. These are the verticals. And once again, just to graze against the side of the anatomical marker. Okay, collimation. Filtration, next step, we're going to use a 3 and a 4 millimeter filter. 3 millimeter thickness coming down to cover the patient's orbits. Usually you have to bring it down to at least the nasal flares or the patient's top lip in order to get that filter to cover the eye sufficiently. Remember, we don't want to bring our filter in too far to cover into the horizontal crosshair, so you need to see a little bit of a light strip between the filter and the corner of the patient's mouth. 4 millimeter filter on the bottom of the collimator housing, coming up to, but again, not touching into the horizontal crosshair. So this bottom 4 filter usually comes up to about the level of the chin to cover the thyroid. Okay. Next step, we're going to instruct our patient, and this is important. We need to make sure we're sighting along our horizontal crosshair into the patient's mouth, and we're going to instruct the patient to open up her mouth wide as she can. So she's going to do this by opening her mouth and bringing her bottom jaw down. We don't want the patient to extend their head towards the ceiling when they open up, okay? So keeping your head still, I need you to stretch your mouth open wide by lowering your bottom jaw as much as you can, okay? Okay, and I'm going to sight along that horizontal crosshair, making sure that the crosshair is not touching the top or bottom molars. If it was, I would need to raise or lower my tube a little bit to clear the molars, but it looks good, so you can close your mouth. Okay, we're getting ready to take your picture, so I'm going to instruct my patient. Once again, I want you to open up your mouth wide as you can, just by dropping that bottom jaw. Keep your mouth open while we take this picture. We're going to step back, make the exposure, relax the patient. You can close your mouth, release the head clamp, lock it in tight, remove filtration, pull the patient forward a couple inches so that we can bring our bucky straight up and down so that it is safe to remove our cassette. And change your cassette. And your cassette goes in for the next image. Locked in tight. We're going to reset our exposure factors for the next image. I'm going to reposition my anatomical marker, or at least make sure it hasn't fallen off the bucky. And we're going to reestablish normal head carriage by bringing the patient's chin back into alignment with her highest slash mark of the normal head carriage posture. And that concludes the A to P open mouth image.